Chairman Miller, Ranking Member Klein, members of the committee, I'm a 22-year breast cancer survivor, and I represent the National Breast Cancer Coalition, a coalition of hundreds of organizations and tens of thousands of individuals dedicated to ending breast cancer. We recognize that we will not achieve that mission unless everyone has access to the quality care they need. NBCC is grateful for the opportunity to present our positions to this committee, and we're excited about the possibility, which we want to make a certainty, that this country will enact guaranteed access to quality health care for all, now. We have a grassroots board of directors. It's 25 of our member organizations, and they spent several years working on this issue. We invested resources in educating them, our field network, and the public about the various approaches and issues surrounding healthcare reform, and we developed a framework for a healthcare system guaranteeing access, which was submitted for the record with my written testimony. We need a system of patient-centered care. Yes, a term that gets thrown around quite freely. But you know the problems. There were some stories identified in my written testimony, and there are so many more. Women sharing prescription drugs, delaying treatments, losing their jobs, then losing insurance, facing a diagnosis of breast cancer. Our focus as a nation should be on solving those issues, always centered on the patient, on the individual. How do we reform the system so that everyone has access to the quality care they need when they need it, that guarantees everyone a comprehensive set of basic benefits that are based on evidence or are contributing to the evidence base? We know you have many pressures from many different fronts, but we need to always keep focused on the patient, on the individual, centered on that goal. We should not begin by figuring out how to maintain drug prices or physician reimbursement or maintain the existing insurance industry. Those issues should only be addressed within the context of, first and foremost, the patients, the health of the individuals in this country. The history of healthcare reform is the story of all constituencies that don't want to give anything up. We all have to give something up to achieve our goal, money certainly, and the National Breast Cancer Coalition understands that. And our framework makes clear we believe in shared responsibility. We should all share the financial cost of reforming the system. Perhaps we have to accept the longer wait for a test that would adversely impact our expectations, but not our health. But what we don't want to give up is our health, our lives. We've all been working on these issues for many years. We know what to do. We just need the courage to do it. We applaud the approach outlined by this committee. It meets many of the principles of our framework for access to care. Our efforts in this area were led by Carolina Hinestrosa, the Executive Vice President of NBCC. She died on Sunday as a result of side effects from her breast cancer treatment. She spent her last days working on this, and we will work our hearts out, passionately committed, for Carolina, but also because we know it is the right thing to do, and it's necessary to reach our goal of ending breast cancer. We need to make certain that this system supports the right care. We need comparative effectiveness research to reach that goal. Now, we have spent some time understanding the issue beyond the sound bites and recognize without question the need for this approach in healthcare. Comparative effectiveness research is research in the real-life settings all doctors and patients face. This is an extraordinary time. We're ready to change for the better the system of healthcare in this country. The infrastructure we build to get there needs consumers and patients at all tables. Their perspective is necessary to ensure that decisions regarding healthcare will have a meaningful, positive impact for those on the receiving end of care, the patients and their families. And they are the ones who will have to navigate the complex web of rules and requirements in any health insurance system. It is important that it's not just any patient or consumer. They must be accountable. They must represent to and report back to organizations that represent those affected by their issue, by their medical condition, and must be knowledgeable about the healthcare system and well-trained. I didn't understand why in the 1990s, when healthcare reform efforts failed, the American public did not storm Washington and demand that Congress and the White House make access to care a reality. This time, we are ready, and we are passionately committed to achieve that reality. On behalf of the National Breast Cancer Coalition, we pledge to work with you to achieve the goal of guaranteed access to quality healthcare for all. Thank you.